Welcome, ladies and gentlemen, in person and joining us, and a particular welcome to our colleagues from Arlington County Public Schools. We are joined by the school board, the superintendent, some other staff that I'm sure Dr. Cannon will want to announce. We are delighted to have you. It's really nice to be around a table together for the first time in 2 years at this point. And I think that we will actually have a relatively brief session today because our colleagues on the school board, of course, adopted last night, and I think are probably have talked about their budget as much as they need to for at least until the end of spring break. But we're glad to have you here so that we have a chance to learn a little bit more about what's included in your recommendation, and of course to share a little bit about what the manager has proposed, and of course some of the things that we are working on as we head towards budget adoption on the 26th. So without further ado, our sincerest welcomes. We're so glad to have you, and I'll turn it over to Dr. Cannon for comments.
Absolutely. Thank you so much. And yeah, let me say on behalf of the school board, we are thrilled to be here, and it has been over 2 years. Like so many things, it's really wonderful to see you all in person. So we are here today to first present our budget to you. And as you mentioned, we just adopted our proposed budget last night. We will finalize our budget on May 12th. I know you know that we still don't know what our state revenues will be, and there may be a few other adjustments that we make along the way and a couple of items that we're still talking about. But for the most part, what we adopted last night was overwhelmingly what the superintendent proposed to us as his budget. And there's an important reason for that. A lot of hard work and thought was put into it. We are laser focused this year, of course, on our students, their academic progress, their well-being. Focusing on our students means also prioritizing our staff. And that's what you will see in this budget, is a lot of new investments and investments in needs. And let me be clear, this is not, a budget with lots of sort of fun things that are sort of nice to have for a school system. This is a budget with needs, but needs that have been very carefully identified to make sure that all different types of students we have in our system are getting the supports they need. As you know, we're coming out of the pandemic, so those needs are greater than ever. And as you also know, because you face the same thing, we've faced 2 very difficult budget years. So we have to get through those budget years. As you recall, we did have to use a lot of one-time funds to get through, to continue investing because that was so important. But we are now trying to build back toward a point where we're a little more sustainable. We're not there yet, and you're going to see that as well. But again, I think that we have a terrific budget that addresses our needs in new ways and is also getting us back to that point where we will be sustainable going forward. So I'm really proud of where we are. I'm optimistic about our future. And again, because this budget is so much what the superintendent brought to us and worked so hard on, he's going to do the presentation to tell you about it. So shall I turn it directly over to Dr. Duran? Dr. Duran.
Thank you very much, and it's a pleasure to be here. This is my first time physically being here, so it's great to be here as my first budget presentation with this type of budget. So if we can please, thank you for bringing up the slides. Can you please go to slide 3? So I'd like to begin by just providing a little overview about, and I want to thank the school board members, and I shared this last night, but I think it's important to note that in previous years, board direction that's been provided to us has been a needs-based budget. This year was very different. You can see on the slide here, this year we were given clear, more specific budget direction to think about what is it that should be brought forth in the budget. And you can see that student academic success and well-being was a key part of this, making sure that we were investing in our staff and looking at the compensation that was needed, and also our strategic plan goals and ensuring that this was aligned to those. Again, not just bringing needs-based, but being really tied into these priorities. We also are beginning the process for collective bargaining, so we wanted to make sure that we put the resources for that. Next slide, please. As we built the budget, we worked very closely again on those priorities, but I will say that one of the main ones that you'll see in the funding was our compensation for our employees. We embarked upon a compensation study, and through this budget process, I'm very proud to say that we're able to recommend, and the school board adopted, the funding of the full compensation study. We have many, many other requests that we know are important for our school system. However, we made sure to prioritize. And so there are other things that are not reflected in this budget that are necessary to the school system's success long-term, but prioritization, you'll hear that word over and over again in my presentation, was key. Additionally, we reviewed all of our baseline budgets to find any efficiencies that we could find, and we were able to find some of those. And I do want to comment specifically that we did use reserves a lot for closing out and making sure we balanced the budget, but they were strategically used to offset some of our one-time costs, as well as 50% of the increases in our compensation and debt service. While we've used a large amount of reserves for this budget, we do have remaining reserves in the amount of $22.1 million, not including our capital reserve. Next slide. So our fiscal year 23 budget totals $74.2 million, which is an increase of 6.8% over last year. And that's based upon Governor Northam's proposed budget. And as Dr. Cannon said a moment ago, we are still awaiting the state final revenue. Currently, the Senate budget that was passed would provide us a little over $1 million additional dollars, while the House bill that was passed would provide us a little over $3 million less. So we are waiting to see what that might look like moving forward. And obviously, it does have the increase of 7% we received from the county transfer. Next slide, please. So as I talk through what is in the budget, I'd like to provide a few of the highlights connected to each of the priorities. Next slide shows priority 1, which is really our academics and student well-being as a key part of what we need to invest in. And we had a focus on literacy and math this year. Next slide. So you can see on this slide that funding for priority 1, one key element was to reduce our class size and provide reductions at the elementary and high school levels. At the elementary level, it was 2 students less, and at the high school, 1. And for our middle school students, we're able to now put in place a middle school teams model and funding. Why is that important? It is an opportunity for now at our middle schools to be set up in a way that all of the teachers around the core subjects are serving the same students so that they can have a close opportunity to get to know the students and their families and provide not just academic success, but social emotional learning and meet the needs of students. So it's a really important research-based proven strategy for use in middle schools. We've also increased staffing and services for our students with disabilities, and as well as some additional resources for our English learners, and we've included mental health supports for our students. And the investments for priority 1 is about $19.6 million or 181 FTEs. Next priority is really focusing on our strategic plan goals. And in the next slide, you can see that primarily in this area, and this is one where we had a lot of other recommendations in our strategic plan, but we, again, trying to prioritize. So you'll see a small amount here of just $0.4 million, which really is some additional funding to provide supports at our high schools for some of our equity and excellence coordinators. We had some, particularly at Yorktown and at HB Woodlawn, that are not the same amount of resources we were giving to our other high schools. You can also see here we have a policy director, which we feel is very important for us as we are learning more and more about some of the changes. We need to make sure all of our policies are properly aligned. And then we do have expansion of a partnership coordinator that the school board put in last night. And so the total investment in this area is $0.4 million. Next slide, please, is our priority 3, which is probably, again, the largest part of our budget that you'll see, because this is the area where we spend a lot of time really understanding how do we have the proper compensation for our employees. So on the next slide, you'll see that, again, we were able to fully fund our compensation study on all the recommendations. And I want to pause and remind a couple of the highlights. The compensation study. One of the key elements of the compensation study was to ensure that all employees, not just teachers, all employees and the scales would be in the top 3 in Northern Virginia area. And so we looked across and had a consultant make sure that our salary scales were in the top 3. We had some in the very bottom, some were already in the top, depending on the range, and some were in the middle. But we did not want to be at the bottom or the middle. We wanted to be in the top. And the top does not necessarily mean number 1, because we'll never be number 1 as we change our salary scale, and so do other school systems around us. So we wanted to be in the top. That was one key important element. Another important element was many of our employees were leaving Arlington Public Schools to go to our surrounding school systems who had been with us for some time because they had not received their steps, which meant that they were stopped on the salary scale and did not get the compensation for the years that they had been serving in Arlington Public Schools. Yet when they would go to a surrounding school division, they would get their years of service, which would in some cases provide them $15,000 to $20,000 more just by leaving us. So we wanted wanted to make sure that we provided that retention that was needed for and that commitment to our employees. So there are adjustments that they would have their steps that they had lost. There were 4 at one point if they'd been here. So that's a huge investment that you'll see. We also are beginning the process for our collective bargaining, and so we have 2 positions that are needed for that, and that's in our collective bargaining office. That's a director of labor relations, as well as an assistant to that person, and then additional funding that's been restored for our nationally board certified teachers. So you can see $36 million investment in this area. Next slide talks a little bit more about what I was just saying a minute ago, and going a little bit more detail on this slide about, because again, this is the largest single investment you'll see in this budget. And it's really, really important that, again, everyone understand why this is a key element. We've got to place the value of our budget on our employees to show them that they are who we're committed to keeping, to help us retain and recruit. Just last Saturday, we had a hiring fair, a virtual hiring fair. Hundreds and hundreds of employees, prospective employees signed up, and we're very excited to want to come here. And we began offering many contracts already to those vacancies. Pleased to just found out today that many of those were also for psychologists and social work vacancies. And this year we'd had some. So it's already paying off by people seeing that this is an important element for us. You can see here, I'm not going to go into all the details here, but I'll just highlight that for our teacher, administrator, and professional scales, you can see the average pay increase is about 6.8%, and for our support employees, it's 9.5%. Next slide, please. So on our 4th priority, this was operational efficiency and making sure that we're able to deliver our services to our employees and our staff and our families. So on the next slide, you'll see that we have additional investments for some of our network infrastructure and technology. We also have increased funding to maintain our system-wide operations, and our safety is really important. So we've included 5 additional FTEs for school safety coordinators at our schools. And the Washington Liberty Annex, or formerly the Education Center, is now going to be opening in the fall. So we do have funding that's needed for that. 2.5 custodians, an additional assistant principal. So you'll see in this area about $9.8 million. So those are our priorities, and I wanted you all to see how we aligned our investments directly to those priorities. Next slide, please. This graph provides a little overview of our enrollment from 2000 and our projected enrollment to 2031. Since 2005, you can see there's been an increase of 46% from our enrollment. Even though we've had a little dip since 2020, there's still been that large increase. And while we've seen that increase, enrollment is projected to level off with only a slight growth to peak in 2024. But of course, this is something that we have to watch more closely, because this is contingent upon what we're seeing coming out of the pandemic with some dips. So we don't know if that will rebound, but based on current numbers that we're seeing, we are not seeing the large increases every year that we had in the past. So we will continue to look closely at that and make sure that we are monitoring the projected enrollments. And as I indicated at the beginning of this presentation, there are a lot more operational efficiency requests that we received, but these were the ones that were most needed at the time to make sure that we could prioritize. Next slide, please. As I wrap up, I thought it would be important also to kind of give a different view, not just by the priorities, but how does this look in terms of investment in our students, investments in our schools, and investments in our staff. This slide, on the next slide, you can see how all of these different positions, I won't read them all to you, but you can scan and see there are a variety of new positions that are very important that are directly investing in our students. And when you think about it, not from the priority perspective, but from the perspective of our students, that's 76 FTEs and $8.3 million that will go with positions that are directly providing services to students. These are things, as I said earlier, like supports for students with disabilities, as you can see, additional staffing for social emotional, mental health, as well as some instructional resources and additional adoptions for curriculum that are very, very much needed. The next slide is a quick overview of our staff. As I said a minute ago, this is the largest number you'll see because the bulk of that is for our compensation study, $36.8 million, and only 2 positions, which again are related to the collective bargaining office. Next slide is how you look at this big picture from supporting our schools. 11.9 million, or 106.4 of the investments are directly in our schools. And I will say of the 106, or directly supporting schools, I should say, because of the 106.4 total new positions, 94.4 are physically in schools. The other are supporting schools from central office. So that's 89% of these investments are directly school-based positions. The next slide is looking at it from the perspective of supporting our school operations. And again, there are much, much more we need to do, but here's some important ones that were immediate needs. And those total 9.1 million or 9 positions. And I mentioned some already that are critical, like our safety security, to restoring 1.5 million of our MCMM, which was a reduction previously, and an increase in our debt service of 1.5 million. So I did a very, very high overview of our presentation, and I'm open to ask any questions. I want you to take away, again, priority, priority, priority. Investment in our students and in our staff was what drove this budget, and it is something that we'll continue to do moving forward. And I want to thank Mr. Schwartz for his partnership as we developed the budget and the close partnership that we've had working together, and thank, of course, my staff that are here with me, Leslie Peterson, Assistant Superintendent of Finance, and our Chief Operating Officer, Dr. Mayo. Thank you.
Well, thank you so much, Dr. Duran, as well as Dr. Cannon. We are going to pause briefly before we get into questions because we have the chair of our Partnership for Children, Youth, and Families, Megan Mack, with us today to share some recommendations from this entity, which is jointly appointed by both of our boards and certainly focuses on an area that I think is of high concern to all of us, which is the ongoing well-being, both social, emotional, physical, and safety of our young people. As Ms. Mack organizes herself, Mr. Manager, do you want to be a gentleman and give up your seat for her? Don't mind being away from the table for a minute. Yeah, exactly. Happy to sacrifice. And as Ms. Chair Mack takes her seat, I'll note as well, we are in receipt of a really thoughtful letter with some recommendations from our Teen Network Board, which is a pretty extraordinary group of young people and it needs no qualifier, leaders in our community who've given us some reporting on both of their work and some recommendations for our budget considerations. So without further ado, Ms. Mack, we're so glad to have you. Welcome.
Hi there. It sounds like this is on. Hello, my name is Megan Mack. I'm the chair of the Arlington Partnership for Children, Youth, and Families. It's a community-led advisory group with 16 appointed community members, 8 designated Arlington County government and Arlington Public School staff. The partnership focuses on improving the health, well-being, and safety of children, youth, and families through researching young people's needs, advocating for improved policies and programs to meet the needs, and engaging members of our community as part of the solution. The partnership is committed to equity, that all county residents, regardless of race, ethnicity, country of origin, sex, gender identity, sexual orientation, ability, socioeconomic status, or other characteristic, have access to the opportunities they need to live healthy, successful lives. We thank you for inviting us to participate in this budget work session. Our assessment of the county and school budget proposals is based on findings in our 2020 Your Voice Matters survey, our 2019 Youth Risk Behavior survey, our 2019 community report, and recent conversations with community members, students, and county and school staff. We have recommendations in 3 areas: promoting youth mental health and wellness, supporting and retaining public health professionals, and fostering family support and community engagement. First, promoting youth mental health and wellness. The partnership strongly opposes eliminating 2 school psychologist and 2 social worker positions that was in the proposed budget. And rather than eliminating positions, the partnership recommends increasing the number of mental health staff in schools. Mental health staff should be as near full-time as possible in every school so they may implement prevention, address urgent needs, provide consistent support to the school community, and build essential trust and rapport with students. According to the findings from the 2019 Youth Risk Behavior Survey, 1 out of 3 students in Arlington high schools reported feeling sad or hopeless for 2 or more consecutive weeks during the prior year. 6% of high school students reported that they attempted suicide during the reporting period. The data identified disparities that must be addressed. Self-reported experiences of depression and thinking about suicide were higher for girls in middle and high school. Latino youth reported a higher incidence of depression and attempted suicide. LGBTQ youth reported higher rates of depressive symptoms. Of the Arlington youth reporting depressive symptoms, only 30% said they received the help they needed. Black and Asian students reported that they received little to no help. Increasing psychologists, social workers, and counselors will support Arlington's equity goals. Without question, adult supports, such as school psychologists and social workers, are a key factor in mitigating negative experiences in the life of a young person. As explained in our 2019 community report, most youth in Arlington have someone to talk with, but many do not. In middle school, about 11% of students reported they had no one to talk to if they were upset, in or outside of school. Additionally, 37% of the middle school youth who reported having no one to talk to if they were upset also reported feeling sad frequently, as compared to 14% of students who had an adult to go to. Moving very briefly to our second and third areas of focus, second is supporting and retaining public health professionals. The partnership values the role that public health staff have played through the pandemic to keep our communities healthy. The county effectively responded to the pandemic with public health nurses providing safety net services to low-income households, such as maternity, family planning, TB, and STI/STD treatment. We value that these services are provided to community members without regard to immigration status. We hope the county will look to increase public health staff in future years until we have a public health nurse in every school. Our third area of focus is fostering family support and community engagement. The partnership has been a longtime supporter of our county's child and family services. We advocate for continued support for efforts to help our most at-risk families, including Project Family. In summary, we hope the county and schools will not make reductions that will directly impact student well-being, particularly at a time when pandemic recovery is impacting our youth. Instead, we encourage the county and school boards to grow investments in these areas. And finally, as you've heard, I know the Teen Network Board was unable to join today. The partnership supports the budget response memo that TNB submitted. Thank you.
Thank you so much, Ms. Mack. If you perhaps wouldn't mind staying close, that would be great. You don't have to sit at the hot seat with us any longer if you like. And if there are any questions or discussion for the partnership, we'll have you available. And then we can instead bother our manager for responses to questions in the meantime, too. Okay, so I think we have this next period for conversation among county board members in particular. If we have questions about the summary of the budget from the superintendent or other items for our colleagues on their deliberations. I'll look for lights. Mr. DeFranti, would you like to start?
Sure. Thank you, Madam Chair. First, this is more of a thanks to, because you mentioned that the school board just added last night the partnerships position, and I kind of just want to say thanks for that. From afar, it seemed like a great position that could have some catalytic benefits. So that's great, and that's not saying, Dr. Duran, that you wouldn't have supported, but I guess, is there context that you might be able to share regarding the psychologists and social workers? And I was on the school budget committee, and we added, 5 years ago, we added a lot of psychologists and social workers. So I'm not predisposed to say, oh, that's necessarily a challenge. There might be context to be helpful.
Sure. So the 2 psychologists and 2 social workers that were in the initial proposed budget were reductions based on enrollment. So we have all of our positions of those natures there's a planning factor for the number of students, and that's why there was in the proposed budget a reduction of those 2. At the adopted budget by the board, the school board proposed budget they adopted last night, those 4 positions were put back in.
Comment, please.
You know, especially with the partnership here, you invited conversation. I'd like to give a little more context to the whole picture, and especially regarding the advocacy. We actually, the school board, starting in 2016, and thanks to county support, of course, through our budget, began a 3-year rollout to hit the point where our psychologists and social workers would be at a ratio of 1 to 775. It actually took 4 years to complete that rollout, and we actually sort of, took some aggressive risks to get there, but we did get there. But we are now at 1 out of 775 for both of those. And as Dr. Duran said, with the reduction in our projected enrollment, that's what caused that adjustment. I think we're now talking about the question of, we in fact know that the appropriate ratio is 1 to 500 or 700. So we're still a little bit not quite at the optimal ratio. So that may be a conversation that we have going forward.
Thank you. Great. And Ms. Diaz-Reyes, did you want to follow up on the same item?
No, I actually did. I wanted to mention exactly what my colleague said. The appropriate ratio for school psychologists is 1 to 500, as recommended by the National Association of School Psychologists. And the ratio for social workers is 1 to 250, or one social worker for 250 students. We are currently in compliance with VDOE requirements. The 1 to 770 got us in under that bar of being in compliance with what is required by the state. However, this is clearly an issue that is at the forefront of our attention and that we've been talking about for a long time, and that is going to require the additional investment. Ms. Peterson, during the work session on Tuesday, did some back-of-the-envelope math on what it would take to get us to the appropriate ratios. It's in the range of 8 to 9 million. And so it's a not insignificant chunk of money that we are not proposing in this particular budget, but making you all aware that this is something that is important to us and that we think is going to be necessary, especially given those pretty jarring statistics.
So, Madam Chair, so in continuation to that thought, I mean, for me, the formal ratio or the appropriate ratio or the empirically recommended ratio is one thing. The other thing is a 6% suicidal students is, I mean, to somebody who doesn't know more about that, but it sounds pretty important to me. I mean, this hits me. I mean, this means that one in every two classes, more or less, is a suicidal person, a person who thinks about taking their life. So the question is, what kind of resources, additional resources, could be appropriate for the panoply or from the toolbox that we are now on the county side are dedicating to mental health response that could be useful for schools?
I'm sorry, is that a question for the school board, or is that sort of a discussion for us on the county side?
Sounds like.
I mean, this is, I will say this is very evocative of a very detailed conversation we've had throughout this budget cycle, I think well before and after. Mr. Dorsey wanted to weigh in, and then I see Ms. Kadera. Yeah.
Thank you. Just getting back to the numbers, does anyone know to the extent to which those standards have been altered or are considered to be altered based on needs that have emerged through the pandemic? We certainly know on our side, there's a depth of people who are going through emotional distress who may not necessarily qualify as seriously mental ill or be a part of the framework by which these standards were all created, but nonetheless present a need. And so what we've identified is perhaps a $9 million future gap to get with standards. That was based on sort of pre-pandemic. Okay.
Ms. Kadera?
Yeah, I would add that in addition to our psychologists and social workers, to Mr. DeFranti's original question, beyond those two roles in this budget, we have added interlude therapists, which are another mental health support for a population of our students. We add behavior interventionists. We add a tiered system of support specialist position. So there's kind of a network of not just beyond those two positions, a network of trying to create a safety net for our students insofar as that is possible during the school day. But of course, we know that they're students in trauma, students who are in crisis, that is a 24/7 experience for them and their families and for the teachers that are trying to support them in their classes. And we're hearing from staff that this is a year like no other when they talk about what they're seeing with their students. We're hearing about difficulties families are having getting services outside of school with seeking help from licensed therapists and other providers. So my sense of this, and I'm glad we're having this conversation, is that this is going to be a multi-year effort, not just within our school system, but as a community. And I've talked with a few of my colleagues on the county board of feeling like this is a topic that I think is a high priority for all of us, and I'm hopeful that we can continue this conversation and think about a 2 or 3 or 4 year combined plan and collaboration that we could put in place as a community to serve these students and address these very, very serious needs.
Mr. Pretty first, then we'll go to Ms. Garvey.
Yeah, I just wanted to point out that 6% number was from a survey pre-pandemic. So we're going through the Your Voice Matters survey now again, so we'll have updated numbers. But as you can assume that the numbers are probably higher now than they were before the pandemic. So.
Is Ms. Garvey?
Yeah, great. I too am glad we're having this discussion. I think mental health is a huge issue for all of us in the community. In fact, obviously nationwide. I had two questions. One is I know you have planning factors and they're sort of structured. You know, how many what's the ratio supposed to be? But do you look at each school, because I suspect different schools have a higher population who've got mental health issues than others. In other words, it probably isn't the same across the school system. I see nods here, and I am not assuming that those schools that have higher income families actually are necessarily better off. I think sometimes there's more stress and strain. So I don't want to say what it might be, but are you looking at those numbers and sort of comparing so that one school maybe needs a little more help than another, no matter, aside the sort of ratios aside?
Well, the ratios are not looked at differently school by school at the moment. They are based on enrollment. However, some of the additional central office supports that we have that Ms. Cadera was referring to, some we are adding a few more, 6 new positions. Those are looked at the data to determine which schools of those will be providing support to. So it's a combination.
Thank you. That's like the perfect answer. I think that's a great answer. I had one other question along these lines, if I might. And I think the cooperation is good. I assume, and I realize I don't know, that there's coordination between social workers and school psychologists and our DHS, because a child who's having a hard time may come from a family that's having a hard time. And is that coordination happening as well as it might?
Yeah, each of our schools have a mental health support team, which has social workers, psychologists, as well as our counselors, and they do have a partnership with our county. And as they are identifying students and families that have needs that go beyond what we can provide during the school day with the resources we have, they are partnering with the DHS.
Thank you.
I think sure, and then we'll go to Mr. DeFranti.
Sorry, it's just a build on that comment. I do think that there is an opportunity, what I'm hearing from some staff in our school system, there's an opportunity to have DHS services provided on site in our schools. And I understand from at least a couple of our staff members that perhaps that happened with greater regularity than it is now. And so I would just put that forward as something that we should look at, so that if we can eliminate the barrier of students and families traveling to access services, I think that we're all well served.
Thank you. Mr. DeFranti.
So this is a shift off of psychologists and social workers?
I wanted to add just one comment myself on mental health, and then let's do it. I really appreciate the conversation. I just really wanted to associate myself with something Ms. Cadera said in particular, and I think this is true for both of our budgets, that I think youth who are sort of have reached a clinical state tend to get the most focus, but it is the tip of the iceberg. And I really appreciated your point about it is actually not just about school psychologists and counselors. And there are many youth, and I know we always see this, right, with the youth risk behavior survey that the partnership always helps us parse, right? That it is a whole continuum of youth engaging in different behaviors that we may want to try to redirect them from or support them at difficult times. And so I think sometimes we can fixate on, and we do this on our side of the house, so to speak, too, where we look at, our challenges hiring and retaining clinicians, when in fact it may actually be about having that social worker who can connect the family to stable housing. And that's actually the best way to deal with the very real trauma that child might be experiencing, irrespective of any kind of diagnosis. So I really just appreciate the effort to kind of complicate that picture and to really point to areas throughout both our budgets where I think we are trying to meet the needs of a community, many members of whom have experienced some kind of trauma over the past couple of years in particular. So thank you. And then Mr. DeFranti, please, onward and upward.
Sure. I sort of want to be parsimonious with questions, but there are a couple other issues I wanted to just, slide 9 talks about class size, and there's tiered system of support, tiers, which is increased. And one of the bullets, though, I just am curious about, having been a teacher, there's 35 students, Ms. Diaz-Torres, you had taught with 47, it's indelibly in my mind, and that's crowd control. So class size certainly matters. But the last time I looked at research, there wasn't a lot of causation as to student achievement through class size. And so that first bullet of your 4 or 5, which is just middle school and is broadly bringing down the size of classes, I'm not here to say I think that's important. I'd love to do it. It does bake in and change future budgets for the schools and the county. And I'm just curious, has there been updated research, or because students with disabilities, and, low-income students, students of color, last time I looked at our achievement gaps, they were still significant, our opportunity gaps, they were still significant. But I'm just curious of that decision, because there may have been more updated research that is sort of showing the benefits of class size reduction. I think what we've done in this budget is reverse a trend of 4 or 5 previous years, if I'm not.
So the research that really is connected to standard-based achievement results and class size has not been really greatly updated. To your point, that's like down to like 15 students is what the research shows. However, with regards to class size, there's been a lot of research and discussion we just had a moment ago about the number of students and the needs that they're having, social emotional, beyond the ability to score on a standardized assessment, which is what that research is solely about the ability to feel safe, welcome, to understand their needs, to know their families, to know each other. There's been a lot more of that showing how the less number of students that you have does have an impact on the academic success in that way. So not correlated, again, to a standardized achievement score. To your point, those research studies have not changed much. The middle school one that we talked about is research that is strong to show that having the team model, and it doesn't talk about class size per se, but the team model does have a major impact. And we heard the statistics about the middle school, right? They were very great. Large numbers of statistics of students at the middle school level with concerns. So the research around the middle school team is solid, to having students have the same group of teachers who get to know them, their academic needs, their emotional needs, to be able to provide them a better support moving forward. So yes, and to answer your question, yes, there is some research, and the point is, no, it has not changed on standardized achievement results.
Sometimes you ask a question you don't know the answer to, and you get a fully satisfying answer, and I'm just super grateful. And I know other colleagues on both will be interested, but I don't want to lose summer school, because I also see it as linked to some of the learning loss that we're seeing, for all students. Thanks.
Mr. Durand, I wanted to jump on your first question about the class size, and I'm hoping Ms. Peterson will fact check me if I say this wrong, but just want to make sure we're clear. In the previous budget, we increased class size by 1, I think, across the board. So our high school reduction by 1 really just puts us back to what we were 2 years ago, and elementary decreasing by 2 puts us back to where we were a few years, before that. We have increased elementary, I think, more than 2 in some grades since over the time that I've been on the board. So we're actually not even quite back to the class sizes we had, for example, when I joined the board. And this, of course, we don't increase class size ever because we think it's a good thing to do. We increase class size for budgetary purposes. So as we've been growing, and as you've watched us come to you telling you how we have struggled with our budget, that's often been our sort of last resort way to make sure that we can balance things at the end of the day.
Great, thanks. Mr. Dorsey.
Thank you. So not exactly akin to our last conversation on mental health, but I was thinking, inspired, and Ms. Crystal will remember this, we honored Women of Vision this past week as part of our Commission on the Status of Women's annual event, and one such honoree, Tara McGee, who runs the Girls Outreach Program, which provides a level of support for girls who are at risk, not just those who are court involved, but those who display similar risk behaviors. And so she's, crafted this wonderful program to provide an opportunity for services for those young women. And I was thinking about that, and also the Teen Network Board that I know does some peer-to-peer work in schools to help, deal with issues like substance abuse. Are there ways that we can think about scaling up these kinds of initiatives while we're still waiting for the capacity and the ability in the labor market to attract the kind of clinicians and social workers that we desire? Because it seems like there might be an opportunity to at least provide some help while we're waiting to get to where we need to go.
I would actually would love to chime in on one area of collaborative work that I have the gift of having some visibility into by dint of my role co-chairing Project Peace, is the work that we have of what have now become prevention coordinators. So it used to be pretty siloed work. We had folks working within DHS on education to prevent gender-based or dating violence. There were others maybe working on the sort of drug-free programs and the substance abuse programs. There might be others doing mental health. And in recent years, there has been an effort spearheaded, I think, in part by the partnership staff, right? So the FTEs based, I think, generally within DHS, there's a data coordinator within APS, but the DHS FTEs to bring all of that under one umbrella of prevention. So we have a very talented prevention coordinator, Ashley Blow, working across those issues, works really closely with the Project Peace coordinator, as well as the staff from DHS. So they do a lot of parent outreach and education about, sort of the whole host of behaviors and the services that are available to young people when they experience them. So I don't doubt for a second that there are many opportunities to do more, but we've also made some progress in recent years that I think is worth calling out. I don't know if either of our managers wanted to weigh in more substantively than one board member's eye view of what seems like great work. Okay.
Mic drop moment.
Okay. Ms. Diaz-Torres.
I can also add in that one of the things that we're doing, at least on the school side, this is not necessarily a collaboration piece, but this was mentioned on Tuesday, but there is some pretty extensive culture work that's happening at school levels. And they're using different frameworks. It's restorative classroom, second step, a lot of different trauma-informed ways of creating a school community and teaching norms and procedures and how to engage and how to be productive and exist in a community with others. And a lot of that does include that peer-to-peer connection, and it's happening at all grade levels across the system. It's happening in different ways in different schools, depending on what their culture is, what their focus is, and what the preferences of those school leaders are, but it is happening pretty consistently across our school.
Right. Great. I'm trying to think if I see any other microphones. I don't think so. Oh, please, Mr. Cordonis.
The question that we always ask, how certain are we on the enrollment projections for the next years? What's the level of, I mean, I can imagine that, the more we go further in.
The answer I've always heard that I love is pretty clear for about 5 years, and then after that, it's kids who aren't born yet. So it really gets.
That's our pre-pandemic response.
There's a new response?
I mean, there's still some uncertainty with the pandemic, right? I mean, we lost some of the things you hear or read in Arl now are a little exaggerated compared to where we actually are. We are 1,000 students below our peak. We peaked at about 28,000 students. Today we have about 27,000 students, and the general projections are showing us modestly increasing for a few more years. Well, you saw those projections, and that the uncertainties continue to be the uncertainties. I think we have a really good relationship with the county with getting that housing information, which is huge. I mean, that's the different factors right now are that piece, of course, the birth rate itself, which is now going down. It was going down nationally before it was going down in Virginia and then Northern Virginia, but that's going down. But then the big unknown becomes that sort of opt-in rate. What do we call that? The babies who are born to Arlingtonians aren't necessarily the exact same 5-year-olds that come in for kindergarten, but there's sort of a correlation, and it's kind of that factor that kind of can change over time. Now it's a little bit lower. It was during the recession way back, it went up because people started opting into public instead of private, and then it kind of, it can vary for so many reasons. So there are always uncertainties, but we use a 3-year rolling average. I think we have a really good system in place, the staff that we've built, compared again to what we had when I started on the board is, they're really on top of this, and I think they're going to catch this as it happens. So we shouldn't be tremendously surprised at any point in time. I mean, I think that's what we want to avoid is a major surprise.
Thank you.
Kindergarten capture rate.
Kindergarten capture rate.
It's a very memorable term.
Yes. Yes.
And I will just mention that there was I'm happy to look it up and share it with the group, but when we saw our projections, there was a handy chart that showed our error rate for the last 10 years. And pandemic years aside, our error rate was incredibly small. Our accuracy rate was in the high 90%, and our error rates were between 1% and 2%, something like that. So we were pretty darn close, with the exception of the pandemic years, which certainly were unexpected in a lot of ways.
Great. Okay. Mr. Dorsey, please.
One more numbers question. So Dr. Duran, as you looked at filling your compensation studies recommendations, how much was devoted to correcting the step errors versus just straight line increases in compensation?
I'm not sure the exact number. Ms. Peterson, do you remember the exact number for the step?
I'll be happy to follow up with you for a specific.
We can provide that
That's
follow-up.
fine.
I don't remember
Thank
the
you.
exact comparison.
Thank you.
A large number, of course, was in the shifting of the scale. That was critical. And then to be able to provide everyone one step next year, that's a big bulk of it. Then I think the question you're asking is beyond that for those individuals who lost steps.
Right.
What is that number? So we can provide that to you.
Thank you.
Great, thank you. Okay, I'm going to turn now to our manager to give a very abbreviated version of a budget presentation from our side, and then we look forward to any conversation, discussion there. Mr. Manager, over to you. Thank you.
Thank you, Madam Chair, and welcome to all school board colleagues, and to Dr. Duran, Dr. Mayo, and Ms. Peterson. Glad to have you here. A very short presentation today. We have the slides available. Hope? Yes, okay. So start off with the first slide, which is talks about the total proposed budget, which is close to $1.5 billion. And you can see that I always am very proud that our number one expenditure is the schools transfer. And you can see this year that the county operating budget is going up close to 3.5%. And the schools transfer is an increase of 8.7%. And that's a combination of the ongoing and one-time money. And so we make an effort every year to provide those funds to schools. And I will say this year, one thing that struck me, I'll talk a little bit later about where we are in the process. We had our budget hearing in this room on March 29th. And it's my first time I can recall in 16 of those presentations where no one came and spoke about the school's budget, which means there's either something horrible or something really great going on. So if we could go to the next slide. We spent some time this year, and we talked about these slides with our board a few days ago, which was we wanted to go and take a look back and compare where we are as a county very broadly between fiscal 14 and fiscal 23. So that's 10 fiscal years. And it gets a little tricky sometimes comparing various categories of spending. But you can see that for the county, this is the county budget. On the left, you see the pie chart that talks about all the funding we have proposed in the fiscal 23 budget. The biggest slice, of course, is the transfer to schools. And then you can see the next biggest slice is around our personnel and our employee benefits. And contractual services are the next smallest amount. And then not insignificant amounts of money, but we have the actual operating expenses for our departments, our capital expenses, our contribution to Metro, and then also our ongoing investments in the Affordable Housing Investment Fund. But on the right, you can see as a percentage of total budget how things have either changed or stayed the same over the last 10 years. And for the most part, I would say that things are fairly consistent over the course of time. One thing that you do notice is that the transfer to schools is a little bit higher percentage, and the things that have dropped a little bit is on the employee benefit side. But it's interesting because I know that we feel like we spend a lot of time during the budget season and the rest of the year focusing and trying to hone our priorities. But I would say that, at least speaking from the county board, how budgets have evolved over the last 10 years, the priorities have been consistent. If we go to the next slide, a different way of looking at some of this is talking about the different areas of spending, for example, public safety or environmental services. And you can see we have a box up on the top right that talks about the schools. This is different than the revenue sharing percentage, because the revenue sharing percentage is talking about the amount of revenue that you share, but this is the amount of our total expenditure budget that goes to schools. And you can see it has remained fairly consistent. It's ticked up a little bit. And I have said this many times. We had the opportunity 4 years ago when we were in the process of in the competition with Amazon. And I said it as recently as this morning when I was talking to the national landing bid. Our number one investment is our schools, because it's our number one selling point when we're trying to attract businesses here and residents. And for us, our success as a county is absolutely reliant upon the success of schools. So, we'll gladly have that as our largest expenditure. If we go to the next slide, which is talks a little bit about the timeline, I'm going to use this slide here to talk a little bit about what we proposed on February 12th, the priorities that the county board had. Similar to what Dr. Duran talked about, the number one priority for the board was compensation. And along with that, we had a proposal, a 4.25% proposal for our general employees, 6.5% for public safety. Our other priorities included housing, the environment, a focus on mental health, and more specifically, the follow-through on the recommendations from our police practices group, which had been impaneled about a year and a half ago. One of the places where the police practices group made a series of recommendations the county board adopted in the fiscal 22 budget was to move to a new response model when it comes to mental health crises in the community and a joint Department of Human Services police response. And the county board appropriated funds for that last year. We find ourselves almost a year later in a situation where our priorities remain steadfast in that area. We find it very difficult to hire the staff we need and to implement that model. So I share, well, I know Dr. Arana talked about, and the school boards talked about the need for increased emphasis on investment in mental health services. Saying it and setting aside the money is absolutely a prerequisite. Actually being able to hire the people and implement those programs is a very difficult set of processes to work through. And I know that we've had a number of conversations with schools about their approach to that. And again, we can't do any of that without the people. So what we've done since the proposed budget, and I'll talk about that in a little bit, is to continue to focus on compensation and increasing investments in that. We also continue our investments in equity. And I said all of this, but with the preface, let's not forget from the two slides before, above and beyond all our investments is schools. That's our number one priority. So we have February 24th on this timeline. You can see the school's budget was proposed. In March and April, the county board had a series of work sessions where they heard from all of our departments. We heard from our public safety, police, fire, emergency management, and sheriff, our Department of Environmental Services, Human Services, and Parks and Recreation, libraries, our planning and economic development, and then management and finance, technology services, and human resources. And throughout those work sessions, there were two themes that emerged. I think the first was really, again, a focus on some of the challenges we have in recruitment. And the second, and something that I haven't mentioned yet, was the pandemic. And I know we've talked a lot about the pandemic impacts on the enrollment and on the mental health of students. And I say this not gratuitously, but on the mental health of staff and teachers. And also we have found for our employees, and one of our main initiatives actually this year is to stand up a very strong wellness program for our public safety staff because of the stress they're under. And I think that's something that we're partnering with an outside organization and also the Department of Justice. And if we can show success there, and I think we will, it's something that I think at some point, maybe next year or the year after, we look at expanding that beyond public safety because of the stress and the challenges that are faced there. So we had, again, as I mentioned during our public hearings on the 29th, we had a large number of people come and testify, talking about, for example, the focus on the environment, the need for additional compensation for our employees. And right now, the issue is with the board. Yesterday in this room, I provided an update on mid-year and third quarter. We just today spoke with the chair and vice chair of the school board and have updated your staff on the fact that mid-year and third quarter, there will be, I know you finished your budget last night, you thought, but there will be additional resources available to the school board, and we will be communicating with you about the specific dollar amounts on that. So the pandemic, again, is still, we're all sitting here and we're not quite pretending that the pandemic is over, but it's still a huge focus of our efforts. And that the intersection between our public health staff, and I appreciate you all mentioning that, and also the partnership mentioning the role of our public health staff. I know that Dr. Varghese, whenever he was tired of talking to me, he would always be on the phone with the superintendent, had him on speed dial. And I did want to say, because I think this is really important, because our community doesn't get to see this, I really wanted to give a shout out to the superintendent and to his staff, because I saw it on my side where, and I don't mean this to be glib, but almost any decision we made was wrong, okay? And we were told. And that's okay, because we were going through a new set of circumstances and trying to deal with an unprecedented set of pressures. And I think I'm really proud of how we have dealt with that as a community, but more importantly, in the partnership between the schools and the county. That's not to say it was perfect, and God forbid we ever have to do it again. A lot of lessons learned. So with that, we have, as I said, we finished our public hearing. The county board is going to focus on adopting a budget at the April board meeting, and then we will take up the school budget. And I did want to say before we get to the last slide, it's a shock, but for the first time in 4 years, we will be sitting down and talking about a 10-year CIP. So no rest for the exhausted, and we will be back here again to talk about that. If we look at the next slide, I know that all of you want to know where you can go to get more information. We have a 900-page plus document. I didn't want to go through a lot of the details, a lot of material available on our website. And I know that this is true, at least for the county budget. I can't speak specifically for the school budget, but by and large, we spend a lot of time talking about 5% of our budget out loud. There's about 80% that goes to employee compensation, which I think that we focused on, which is, people will have different views on that. And there's a lot of programs where we carry through on our policies that have been laid out by the board. From year to year, as I've said, and those slides from a few slides ago show, there's consistency of purpose on the part, I know, of the county board, of county staff, and on the school board. So I think it's been a great partnership, and it's been, believe it or not, fun at times. And I know that I welcome any questions that you might have. I'm available here along with staff. Thank you.
Thank you, Mr. Manager. So I think we can throw open to the floor to questions from our colleagues on the school board. We have had seemingly endless opportunities to ask questions of our manager about his proposed budget as we've really begun to discuss in these final weeks. But this may be an opportunity, if there's anything we can share about priorities the board is considering or anything to build on the manager's presentation, we'd welcome that. All right. Yeah. Oh,
I will get us started. I would love to hear more about these plans for support for our public safety officers and how you mentioned that we might be able to consider expanding it, but I just love to hear about what are the supports that's going to be available to this particular population that is experiencing undue stress, so that I can start imagining what a future might look like if we're able to potentially expand this to.
So thank you for that question. Last year, and I think it was in June of last year, we received grant funding from a foundation actually out in Utah, where there's an individual who made it his purpose and left a fair amount of money, where they provided a grant to our police department to work on setting up a whole suite of approaches on wellness. Now, the focus on employee wellness is not something that's new, but doing it on an empirical basis, and we literally just started this program about 30 days ago, where we go in with, whether it's with social workers, psychological services, training, in a way, in public safety, there's always the issue about stigma when it comes to approaching mental health services, but in a way which says, this isn't anything that you need to be afraid of, but you need to be open about it. And we've had some presentations here that, and we've hired Dr. Lisa Cooper-Lucas, who's on staff, and added 2 staff that are working directly with our fire, police, and emergency management to go beyond the level. We had the crisis intervention training, but this is really to go to a place where what's going on at your home, what we have a number of times, and I think the police chief talked about it when he was here during his budget presentation, and he's talked to me about it, where he has had officers come to him and said they're having suicidal ideation, and they're thinking of essentially taking a gun and ending their lives. And that is such, it's shocking to hear, but this is going on all the time in our workforce because they are faced with such incredible stress. And it's okay to want to talk about that and to make that a part of our discourse because of the stress that our first responders face. Now, they're not the only ones who do that, but I was on a phone call about 3 or 4 weeks ago with, we got in touch with one of the assistant attorney generals of the Department of Justice and the National Institute of Justice, who now want to work with us and make this as a template for empirical studies across the country. And we're partnering potentially with George Mason University in their new space about creating an area for conversations about this. Because as I said, there are a number of wellness programs in the country, but hardly any have done the empirical work to show if it makes a difference. It's a good thing to do, but does it make a difference, and do we have the right suite of services? So from that, I don't think that's exclusive to public safety. So with this outside money and the investments that the county board has made, and potentially with a partnership with the federal government, they're very interested in this, because I think at the end of the day, we see in this room, sometimes people come and talk about defunding the police, adding money for the police, but at the end of the day, having mental health as a priority of your police officers who are in stressful situations, I would hope everybody would agree that that's a good thing to have happen.
Ms. Garvey.
Yeah, I appreciate the question, Ms. Diaz-Torres. And, all of us on this side, we have taken ride-alongs with our police. You learn a lot about the county. I mean, it's just a whole different view of Arlington County. And I'm sure the police would be, very pleased to have a school board member come along too. So I would just encourage you to check in with, we can help arrange it, or check it in with Chief Penn. But as I say, I sort of have a different view of the county and a better understanding of what our police are facing.
Right. Yeah, please, Ms. Cadera.
This is just also a follow-up, a note of appreciation for your reference to secondary trauma. And I hear and completely respect the area of focus with your public safety workers, and agree that that there are opportunities to expand. So I'm the sister of an ICU nurse in San Francisco who had to take a medical leave of absence for PTSD for COVID last summer. And our healthcare workers, our frontline workers, the trauma that they experience with regard to moral injury, the things that they're having to do to maintain safety are just really, really stark. And so I think that whatever you learn in this program for public safety, it would be interesting for us to think on the school side about the ways that we can address secondary trauma of educators in our schools, and what lessons you learn that we could apply. I would be very interested to hear. I wanted to pivot to another cheerful topic, if I might, and talk a little bit about this is a question that I've gotten on the school board side. So I'm curious what conversations you have had about it on the county side, which is contingency plans for, knock on wood, COVID, continued need to respond to COVID in our community, and particularly when we look at the way federal programs may be ending or sunsetting, COVID testing for uninsured families in our community. I just would really appreciate if you could talk a little bit about what kind of conversations have happened on the county side, and what members of our community can expect in that regard from both the schools and the county.
I wonder if it might make sense, Mr. Manager, to just talk about Arpa funding, right? And before that, CARES Act and the services we've stood up and the runway we still have.
Right, so part of the allocation of funds, and I know the schools also receive funds under ARPA, we've set aside, we continue to set aside a chunk of funds, and those monies are available through 2024, calendar year 2024. We've set aside allocations to make sure that we have both testing and the equipment needs sort of met through the future. We were talking a little bit about yesterday. We have, fortunately, we've set aside a chunk of money that it turns out that we now are continuing to get Fema reimbursement. So some of that money that we had set aside under ARPA is coming back. And so that's a good news story. And we're trying to integrate some of the, not yet, we have the testing, we have the standalone testing sites, but some of the efforts at vaccination. We have a vaccination program we have had for years in our public health clinics and through the schools, integrating the COVID vaccines into that, and we've actually pulled back a little bit on what we have at Walter Reed and looking to do that a little bit less perhaps at Arlington Mill, depending on what happens, but to make that more part of the normal course of business. But we are ready, and I know that county board members yesterday had a little bit of a surprise tour. We still have a warehouse filled with large amounts of equipment and material ready to go that we have stocked up on in case there's another push in the pandemic. But at the end of the day, we are hoping that some of those issues will be handled, but that's much more on the sort of testing and vaccination side. We have a series of issues we're going to need to look at. I think the pandemic has uncovered some very serious social needs in the community on an ongoing basis, whether in housing, in some in food, and some other areas that I think we've been made aware of some things that perhaps shame on us that we weren't quite as aware of. And I think that the federal funds will go away and we'll have some policy issues to look at.
Thank you. Just the scale of that operation was astonishing. We happened to be, yesterday, you may have seen our public safety teams identified an opportunity to ship a tremendous amount, 2 pallets worth of protective gear, kit, and supplies to Ukraine, which was a pretty incredible opportunity. But just being in that warehouse, our public information officer for emergency services was sharing that, the things you don't even think about what it looks like to have 1 million Band-Aids stored for the vaccine operations at the scale we were seeing. So it's maybe a little disconcerting that we ever had to stand up an operation of the size of the global pandemic, but it was reassuring to me to know that those teams and to some extent those materials remain extant. Mr. Dorsey, another one? No? Okay. All right. Please, yeah.
First, let me just say, I feel like we've identified the big topic, right? It's very clear that this, as we've all said, mental health and well-being is something that we're going to have to be talking about in a variety of ways going forward. So it's kind of, I feel a little awkward even raising a different topic because I think we should really, that should be the focus. But just one thing I did want to just touch upon, and it's one of your pie charts, Mr. Schwartz. I feel like if I just give you the topic and ask you to just talk, we'll get some insights. But the topic is debt service, and the pie chart that showed sort of the overall spending and the total debt service, it looked like with schools and county together was 5%, and our limit, of course, is 10%. So I wonder if you have any, and I know ours is 8%, so that must mean if you average that out, you guys are well below that. Let me just ask you to talk a little about debt service and the upcoming CIP and what this looks like. I won't try to frame a question out of that.
Yeah, and
foreshadowing.
I'm going to ask, I have DMF staff with me, I think that, and if I get this wrong, let me know, those bars were a percentage of the overall budget, not general fund?
No, this is the percent against the general fund budget, but I just don't know if the math is working this way.
Could we invite you to come to the microphone?
Come on, Richard.
So we can hear you. I know it's your favorite thing.
Introducing Richard Stevenson.
The pie chart was a percent against the general fund budget, but I think the way that's calculated is different than you're talking about the debt ceiling. And so my brain's not processing exactly, but it's not the same calculation.
Understood.
Unless,
so that's
correct.
Okay, thank you.
That's for what I was looking at. How close are we collectively to 10%? It's not 5%.
Let me speak to that because I know that there's interest in the community about that as we approach the CIP, which is that, and this is a topic that just keeps on giving, which is that we have a standard, our financial policy at the county level. At the county level, I mean all county expenditures, which include county and school expenditures together. That's what the financial rating agencies look at. The 10% policy is 10% of your general fund budget across, and so that includes everything that's spent, for on the county side, and as I said, a big chunk of that is schools. That 10% limit applies to the debt that both the county and schools take on. So in the past, and I'm getting back, maybe it was even in fiscal 14 when Wakefield High School came up as an issue. There was a long conversation at the time between the boards about how, in order for Arlington Public Schools to move ahead with Wakefield, that they needed, quote, to borrow some of the capacity from the county side. And I just remember at the time, and I think Leslie was here and Richard was here, we all smile in the finance world because at the end of the day, it's all the same money and it all adds up into one big pile. And at the end of the day, 10% is the limit. So it may be when you're going through and doing your calculations, you try to hold that internally to 10%, and we try to hold it to 10%. But you'll look back year over year over the last 10 years, there's been sharing among that. And at the end of the day, it's the overall capacity that matters. And so as we approach the CIP, and a little bit of a preview, we haven't even, next month we're supposed to be proposing that. We have a big project coming up with the Career Center, and that's been included in the CIP. The one thing that's changed since last year, between last year and this year, is Barcroft. And the county went ahead and provided a line of credit of about $150 million. That's a change, and that will have an impact on what that ratio is. And so we will never get over the 10% when we propose it. And so that is, I didn't want your eyes to get as big as saucers when you saw it was at 5% and that you had all this extra money. So that's not true.
Thank you. He was eagle eye. Yeah. All right. Any other questions? Okay, I am mindful, as has been said, we are what stands between our school board colleagues and spring break. Oh, sorry. Did you want to join?
Sorry, I'll just be real. Since we started on CIP, I do think that there are operating concerns. If you guys get the New York Times, the count of cases, and it's not cases, but it's hospitalizations and fatalities that are key. Arlington is for the first time high in Virginia as far as cases, and higher than the nation, which is very rare for us. So I think your questions, your comments about, it's good that we have the millions that we have in our set aside as contingencies to address COVID, because emotionally we're all done with it. But I think that the realities of the numbers don't dictate that we know we're done just yet, and we have to meet that moment. Keeping people healthy and safe, as you guys, students healthy and safe, and keeping everyone healthy and safe is huge. And there are a lot of different ways we can try to do that. I still think it's relevant. So I didn't mean to be a Friday downer, but that is, I think, relevant.
That's an important note. All right.
The plug for the booster.
All right. So unless there is anything else, I think Dr. Cannon summarized it well when you said, I think we've really hit on the beating heart of the issues that cut across all of our functions, and that I think our community needs us to prioritize now. So this is, of course, only the tip of the iceberg of ongoing conversations and future ones both. And would you like to have the last word?
Last word, I said this last night when we did pass our proposed budget, but the reason this meeting is short, the reason that, there aren't fireworks and all sorts of other things happening is because of the revenue sharing agreement. The certainty that brings to our budget process, if you see what's happening in other localities where school boards are bringing their needs-based budget without necessarily knowing in advance what they might get. What we have here is really helps us with a nice, stable process and gives us the chance to put together a really solid budget. So we really want to thank you for that ongoing agreement that we have. And we appreciate being here, and thank you all so much for this good work session.
All right. Thank you so much. We are adjourned.